Hello everybody, this is Dr. Haley from Haley Chiropractic. Today's topic is going to be on the stages of chiropractic treatment care and how far you want to take your chiropractic care. If you look on the screen, we're dealing with a pyramid which goes from a base, which is relief care, all the way up to wellness care. And this is a pyramid that's provided on a sheet from patient media that we like to give our patients so they understand this topic a lot more clearer and they can make wiser choices as far as their chiropractic care. If you look at the base, it's real red, and that's relief care. Red is a symbol of pain and inflammation. So when somebody comes in and they're hurting, okay? They might have been in a car accident, they might have been in a sports injury, they might have just reached over to do some gardening and hurt their back. But most of the people come in, they have some kind of problem going on. And in that phase, what we want to deal with initially is deal with the inflammation. After a few days of an injury, they still have some inflammation. We like to do ice. We like to do our soft tissue treatments, our physical modalities, and you could start gentle chiropractic alignment adjustments to help get them out of the pain as quick as possible. And if you look on the side here, it says we want you to feel better and we want you for the least amount of time and money. We want to let that phase last as quickly as possible. Get you out of pain as quick as possible and try to get on to the next stage, which is correction care. That's really important, and that's where I feel the gap is missing, because people in general, they want to get out of pain. They're not thinking about the future. They're not thinking about why they're in pain. And basically, once they get out of pain, they figure they're okay. I get that all the time. What we want to do is educate you on correction care. Very important. That's when you start increasing your range of motion. We start increasing your overall function. The nervous system starts working better. Muscles start to balance out. And we start the overall healing process. It's a regenerative process. And basically, once we get to that point and you start stabilizing, we get some spinal stabilization in there, and everything's working properly, you get into a maintenance care right here. And what it says here, you want to preserve the progress you made. It's a very important phase, because once you get to a certain level and your spine is stabilized, you want to kind of at least keep it that way. And we teach you a lot of lifestyle things to do, and we teach you a lot of exercises. The top parts here are preventative and wellness. That's when we really try to strive for optimum healing. We work with you a little bit with nutrition. We work with you with exercise. We can work with you changing your lifestyle. As far as if you have a postural problem and it's because you're sitting at a computer all day, which is very, very common, and we see a lot of problems from that, we want to try to teach you proper ergonomics and how to sit properly so it will minimize the stress that your occupation puts on your spine. If you have a job where you're lifting a lot and you have to lift a lot of different items all day, we want to kind of work with you, maybe get you into some exercise so it's not so much of a demand on your spine. So that's where we really start getting into more wellness. Gonna encompass a lot of nutrition, a lot of exercise, try to be overall healthy, optimum function of your body, not just your spine. Okay, so these are the phases of care that we go through. You could choose any level you want to get to. We'll help you on each one of these. But just remember, the bottom part of this pyramid is red, and that's when you got the injury. That's the most common phase. That's one of the reasons people come in here. You don't want to stop there if you can. You want to try to work your way up the best you can. And you can see the red starts to go away. We get yellow, means you're feeling better, and you're starting to stabilize. Then you get to the green. That's the preventative wellness, and that should be always the goal. Okay? This has been Dr. Haley, and I hope you learned something from this short video.